Hey everyone, Mute Sally Patel. Welcome to all in first quick review class by Unlock and Click. So today we are learning about acid-base imbalance. We can evaluate acid-base imbalance through an arterial blood gas, which is an important blood test for measures acidity and the level of oxygen and carbon dioxide in the blood. So in the acid-base chapter, the two main system which is playing a vital role in which respiratory system relate with the carbon dioxide and the kidney system which is relate with the bicarbonate at CO3. So in acid-base imbalance chapter, we are considering CO2 and hydrogen ion as an acid and HCO3 as a base. So, in this acid base imbalance chapter, potassium is also playing a vital role as a balancing the acid base imbalance. But how? So, in acidosis, when hydrogen ion coming into the cell, potassium ion coming out of the cell and cause hyperkalemia to the client, and in the meanwhile, when alkalosis occurs, hydrogen ion coming out of the cell and potassium ion coming into the cell and cause hypokalemia to the client. So always whenever you are checking for acid base imbalance, you will gonna check for hypokalemia and hyperkalemia as a complication because hypokalemia and hypokalemia is not good for anyone. We need to quick notify HCP. For the acid-base imbalance assessment, you need to memorize some normal values which includes pH 7.35 to 7.45, bicarbonate 21 to 28, PCO2 35 to
So, what is
45,
happening with
and
the
PO2
respiratory and
80 to
metabolic system?
100.
So, for the respiratory system, you are going to check for two conditions: respiratory acidosis and respiratory alkalosis. And the same thing in the metabolic system, you are going to check for metabolic acidosis and metabolic alkalosis. So, always remember the mnemonic RO, respiratory opposite and metabolic all equal. So how you gonna use this mnemonic? So whenever you are checking for ABG strips, you are focusing on three main values: pH, PCO2, and HCO3. Okay. So for the respiratory, focus on pH and PCO2 value, and the metabolic focus on pH and HCO3 value because we are learning that PCO2 relate with the respiratory system and HCO3 relate with the metabolic system. So if you are seen in the slide, pH is decreased and PCO2 is increased. We are considering this value as a respiratory acidosis. When pH is increased, PHCO2 is decreased. We are considering this value as a respiratory alkalosis. When pH is decreased and in the same time HCO3 is also decreased, we are considering this as a metabolic acidosis. And if pH is increased and HCO3 is also increased, we are considering as a metabolic alkalosis. So after that respiratory and metabolic evaluation, we are evaluate for compensation. Is that full? Is that partial? Or is that non-compensation? So what is compensation? The compensation considered as a full, partial, or none. So fully compensation, that means pH is normal in that value as the other value is abnormal and has been successful and normalizing the pH. What is partial compensation? So partial compensation, it means pH is still abnormal and the other value is abnormal. They are attempt to help normalize the pH. And with no compensation, pH remains abnormal and the other values will remain normal
What
or
is the
has made
treatment
no
goal
attempt to
and
help their
guidelines in acid
normalize
base
that pH.
imbalance? So, diagnose of why the patient acid base status is such, stabilizing the initial or presenting problem, correcting the fluid balance and electrolyte status, continuously regular monitoring of ABG record, and dialysis to remove excessive lactate, manipulation of ventilation setting to adjust CO2 level, but always maintaining the tissue perfusion. Now we all know
about the acid base imbalance and then let's take some question practice. So, in the first question, the nurse reviews the arterial blood gas result of a client and notes that following pH 7.45 to PCO2 is 30 and HCO3 is 20. So, the nurse analyzes this result as indicating which condition. Yes, you are correct. Like pH 7.45 is okay. It is in a normal range. But if you are seeing that 7.35 to 7.45 is a normal value, the 7.45 still we are considering this as alkalosis. In PCO2, 30, which is decreasing with through the normal values. At CO3 is 20, which is also decreasing from that normal value. So remember that rule when the respiratory opposite and metabolic is always equal. So in this condition, if you are seeing the metabolic is not equal, but the respiratory is showing opposite direction. So we are considering this thing as a respiratory alkalosis. And because of the pH is normal in that rate, we are considering this as a compensating. Thank you for watching the video. I hope this video might help you in your acid-base question. For more informative videos, don't forget to follow and subscribe. Thank you. Bye bye, guys.